This podcast is brought to you by North Carolina's electric cooperatives.
This is NC Spin, an unrehearsed discussion on issues of interest to North Carolinians. Now, here is your moderator, Tom Campbell.
Thank you for tuning in this week's NC Spin. We're happy to return to our normal format with a panel discussing this week's key topics. And on this show, we're going to look at the legislature's return and what they should do in this short session. As another reopened protest was staged this past week, we'll talk about when and how to get our state back to work, and we'll discuss the latest COVID-19 news. Plus, we'll be glad to have the panel tell us something we don't know. Speaking of the panel, this week's panel includes Becki Gray, Vice President with the John Locke Foundation, Patrick Sebastian, a political consultant, and joining us via Skype are Chris Fitzsimon, Director of the state's Newsroom, and Brad Crone, a communications consultant. We're going to begin our uninterrupted discussion after these brief messages from our underwriters.
If you think you may have COVID-19, please remember, people who are mildly ill are able to recover at home. If possible, stay in a specific sick room and stay in touch with your doctor. Be sure to seek medical care right away if your symptoms become severe, like difficulty breathing. Most important, whether you have mild symptoms or no symptoms, we should all stay home to prevent the spread of the coronavirus.
Life's busy, but you're in control. As an electric cooperative member, you have access to lots of tools to help manage your home energy use and budget, so you can focus on what's most important.
In more than 21 years on NC Spin, I never endorsed a product or sponsor, but I volunteered to do this message for family physicians. Over the past 40 years, my family doctor could quickly diagnose my illnesses because he knew my medical history. Evidence suggests I'll live longer, have a higher quality of life, and save 33% on health care costs. I believe in my trusted relationship with my family physician.
Family Physicians, your trusted healthcare advisor for life.
Let's get started. Our state's lawmakers came back to Raleigh for the start of the so-called short session on Tuesday. They've got two main goals. The first is to respond to COVID-19 through appropriations and legislation. The second, to pass a new budget for the upcoming fiscal year that begins July 1st. Observers are going to be watching to see whether there's a spirit of cooperation or partisan politics once again. Becki, there are some suggestions that the legislature is going to address immediate issues relating to COVID-19, then adjourn until June or maybe even July to deal with the budget. What are you hearing?
That's exactly what they're doing this week, Tom. They are looking at the federal appropriations that have come down, all the money that has been distributed across the nation to the states, looking at North Carolina's share and distributing that money in large part along the federal guidelines that have been attached to that money, but also really looking at what they need to do right now, putting some of it aside for later. But that's what this week has been all about, and that is distributing the COVID-19 federal funds that are designated to help North Carolina get through this.
Yeah, the CARES Act stipulates that the state must spend all of the $3.5 billion that's been allocated to it to new costs linked to the coronavirus pandemic. The Senate leaders are asking the feds to change the rules or at least give them some exemptions. Chris, why are they wanting those exemptions, and what exemptions are there?
Well, I think they want maximum flexibility. There are a couple of things happening here. One is, you mentioned in the intro about bipartisanship. I do think for the most part we have seen that in the House and the Senate. There's a disagreement about the amount between the House and Senate bills. One thing I'm a little worried that is not part of the package is money for our state election system, which would draw down some federal money. They say they plan to deal with that later. I'm a little worried we need a long lag time in case there is some sort of reappearance or spike in the prevalence of this virus as we go towards the fall. And the second thing is there's still a push in Washington to actually give direct appropriations to the states, as they did in the financial crisis of 2008, 2009. So a lot of people think that is coming too. All this is a mix, but right now I think they are doing the best they can.
Patrick, Chris talked about cooperation. Ralph Hayes, Senate leader, talked about the fact that they coordinated with the governor, the Democrats, and the Republicans. In fact, on the vote Wednesday night that they held, it was 48-0. When was the last time you saw a 48-0 vote except for adjournment? But they left the House out. Any reason why they left the House out of these negotiations?
I don't think we've had a 48-0 vote since I've been alive, at least. I think the House and Senate are a little bit separate on the different priorities, how much is going to go to small businesses, whether providers will get funding. Or
we're going to talk about some of those specifically. Right. But why didn't they include the House in their negotiations?
Because I think they have their own priorities and they want to put their budget out first and get support behind that. And I guess, frankly, maybe get the governor behind their budget and have the kind of wave follow them, and so where the House has really no choice but to jump on what they already have.
Yeah, Patrick wants to jump ahead and get to some of the juicy topics as we get into this a little bit more, and I'm getting there. For instance, Brad Crone, the House put in a provision to expand Medicaid for those people who were 200% or less below the federal poverty level for costs associated with testing coronavirus and treating coronavirus. The Senate left this out. Any reason that you can imagine for that?
No, Tom, I think they're all in the thicket, and they're going to have to work between the governor, the budget office, the Department of Health and Human Services, and each chamber respectively. When it comes specifically to the Medicaid action, the federal government actually allocated funding to cover the uninsured people who present at our hospitals across the state for testing as well as for treatment with COVID-19.
Yeah, and in like manner, Patrick, the Senate had unemployment benefits increases from $350 to $400 per week. That wasn't in the House measure. That was widely discussed in advance. Any reason for that you can think of?
No, I kind of agree with Brad. They're just right in the thick of things, and ideas are being thrown out. They maybe thought of one House member or one Senate member, not the other. They're going to come together. Speaker Moore mentioned today and yesterday, they're going to come together with one great plan, bipartisan plan. I wouldn't be surprised if unemployment increases are in both plans by the end of the day in the combined bill.
But there were some differences in this, Becki, when you stop and think about, for instance, the House put $135 million in their provision to test coronavirus and do research. The Senate only had $20 million. A difference in priority? You've talked to both the House and Senate leaders.
Well, I think, ramping up this testing, doing broader sampling, and Senator Berger has been at the forefront and actually found some money in the budget, in previous budget, money that he already had, not even part of this negotiation, to do the antibody tests that are being done at Wake Forest Hospital. So, there are different priorities with it. I think there are a lot more similarities than there are differences. It really comes down to, if you look at all of the funding, again, very similar priorities and ideas, differences in the amounts of money going that way that I think can easily be negotiated. I think we're going to see that in the conference committee.
And not huge differences in the amounts.
Tom,
go ahead, Brad.
I think the thing you're going to have to, Becki's absolutely right. It's a process of reconciliation. Both the federal government and the state government are looking at pouring an enormous amount of money into our healthcare delivery system. So they're going to have to reconcile through all the various agencies and the people, the touch points that are going to impact how they deal with it, from the rural hospitals to the suburban metropolitan hospitals, our research institutions, and all the government bureaucracies.
And another reason why you may see these differences in the amount of funding for these particular things is this is kind of a first bite at the apple, if you will, of distributing this money.
Yes.
So I think that, what we're also seeing is not necessarily the House doesn't think it's important. They may just think, let's hold back a little bit, see how our state revenues go, see if there's some flexibility granted by the federal government, and then maybe come at it at a different direction in another couple weeks or another couple months.
Yeah,
so
but Chris,
there's a lot of fluidity
the differences
in this.
aren't that great. The Senate had $1.4 billion. The House had $1.7 billion. The governor had $1.4 billion. And by the way, the Senate said they coordinated with the governor on this. They want to try to work the differences out on Friday. You think that can get done?
I do think it can get done given the spirit of bipartisanship we've seen so far. And remember, amounts, there are always ways to compromise amounts. You could split the difference. You could go up on one thing and go to one person's position on one item, go to another one. I do think it's good you raised the Medicaid issue. That is not as much as an amount as it is a philosophy of making sure that people who are infected with coronavirus or worried that they are, need testing or need care, need to get it. I certainly hope the Senate will come along. That's one of the few items that is not just money, and I hope that the Senate will come to the House's position on that.
And Patrick, I know an item that you've been interested in is so far as small businesses in North Carolina. And both the House and the Senate had amounts of money for small business loans. The House had $75 million. The Senate had $125 million. They're going to give that money to the Golden Leaf Foundation and let them administer and decide on these loans. Is that a good way to do this?
It's hard to say. I think they're going to split the baby, by the way, on the amount of money that they give. And the big debate is, which vehicle do you want to use right now? And Golden Leaf perhaps is the best equipped to get the money out the quickest. But there certainly will be debate on, are they really the right folks to do it? A relatively small group of people making all those decisions. I think they have the advantage right now to be the vehicle to do that.
One other difference that we will highlight here is that the House put $75 million in their proposal for small rural hospitals. Brad, you've been very, very involved in hospitals across North Carolina. These small rural hospitals are really bleeding and need the help. The Senate didn't put any in. Do you think they'll come around on that?
Oh, no, they're going to come around, and it's just a matter of how much at this point in time, simply because the rural hospital healthcare delivery network is under such stress. Well, the COVID-19 response, we've been able to bend the curve. What has happened is the elective surgeries and other revenue streams for the hospitals have been cut. Some hospitals have had occupancy rates between 25 and 30% over the last several weeks, again, cutting into revenue. I heard a figure the other day, Tom, that the North Carolina hospitals were losing as much as $1 billion a month.
Wow.
Now, that's an entire statewide network,
Wow.
But our rural hospitals really need attention.
There were a lot of public school proposals, and after everything sifts down, we'll go back and we'll figure all of them out and report them. But one I thought was interesting, and a difference between the House and the Senate, was that Craig Horn, who is we interviewed last week on NC Spin and is sort of the House education guru and budget leader, put in $35 million to buy computers and tablets, and another $21 million to help internet connectivity. He said there were 300,000, of our school kids. What do we have? 1.6 million school kids in North Carolina, K through 12. There were 300,000 of them that don't have either tablets or internet connectivity. The Senate didn't have that in their budget. Becki, do you think they'll come around to that one?
I think we're certainly going to look at that. Tom, I think many of these examples that you have pointed out that the Senate doesn't have in theirs, but the House does, I think this goes back to not whether they will or whether they think that's an important issue. Is this money at this time the best way to do that? And one thing that I know the Senate's been looking really carefully at is, are there other programs out there? Are there other ways to fill these needs? Are we going to designate money that might be duplicated by some other resources? And so, it's complicated and there's lots of layers to it. And so if you see a hesitation on the part of the Senate, I don't think it's a rejection of the need. I think it is really trying to spend the money well, not waste it, and make sure that all of those dollars that we have are being spread to get the greatest good
and understanding
and meet
there's
the
going
greatest
to be
needs.
there's going to be a second bill that's coming along. Last question on this segment, Chris. We've got $1.7 billion in the Senate bill, the governor's proposal, $1.7 in the House proposal. You've sat through a lot of these budget compromise situations in the past. Invariably, they always end up with a higher number than the highest number. Do you think that's going to happen here?
Well, I think it'll be at least the 1.7. I do think that one chamber will come up and the other chamber will go down. It really is a negotiating point. I don't think there's any I haven't seen any either Democrat or Republican battle initially or House Senate battle over the actual programs. It's just the amount they can do now. I do feel relatively optimistic we'll be able to come to some agreement on the amount and the programs fairly quickly.
But I think it's important to recognize it's not just the amount of money that they spend now. Another really important number is how much do they set aside? How much do they leave in reserves so that as this thing develops, as we see how our state revenue is going to come out, as we see how this unfolds over the next several weeks and months, what is left that they can draw from later? That's another important number to watch.
And we haven't even talked about the surplus that we have in the state budget, even though we're concerned about how this virus and the unemployment and so forth has been affecting state revenues. And we'll talk about that more next week. But for the third week in a row, a group of protesters gathered in Raleigh to demand the state reopen for business. Governor Cooper laid out a plan explaining what factors the state was watching and a 3-stage plan for gradually reopening the state. Brad, there's some voices saying Cooper's dragging his feet, taking too long, ought to be moving faster. But a WRAL poll this week, which coincided fairly closely to a Civitas poll not long ago, indicated a majority are willing to wait until June 1. What's your response to Cooper's plan?
I think it's been very prudent, Tom, at this point in time. I've read John Hood's column on ncspin.com this week, and I thought John made some very relevant points. Yes, we do need reopening. It needs to be phased in. The governor has taken an approach very similar to what the Trump White House has done. It's a 3-phase approach. So I think it's very realistic.
In fact, he's following the Trump plan, isn't he?
He is. Right. And the secretary announced earlier this week in an interview with you that they are moving forward with the phased-in reopening. As a process, you got to be very careful. What concerns me about the Reopen North Carolina effort is it seems to be more militant and more political than trying to make a statement on helping folks across the state deal with COVID-19.
Patrick, let me ask you about this. One of the co-founders of the Reopen movement was arrested on Tuesday. The other co-founder has resigned from the movement because she said the crowds were inciting a riot. That's her quote. What's your response to this movement?
I don't agree with all the tactics that they're having. I think breaking the lock at the governor's mansion was a mistake. I think going out there and protesting without masks is a mistake. I think you need to set an example that if we're going to reopen the state, we're going to do it safely, and here's an example of it. But I have to tell you, they are making I don't blame them one bit for being suspicious and asking questions of this governor and this administration. For instance, you have ABC state-run liquor stores the governor deemed as essential, but then the mom and pop shop at the end of the road is not essential. And I think people are absolutely right to say, well, hang on a second. What is your actual criteria of what is essential and what is not? You had a state senator, I believe it was Jeff Jackson in Mecklenburg County, defend the ABC liquor stores being open as saying that it's because of addiction problems. Well, that's not true. It's because of revenue problems.
I think it's because of homeschooling, if you want to know the truth of the matter. Becki, somebody alluded to it a few minutes ago, but in the interview that I did that aired Wednesday night on UNC TV with Secretary Mandy Cohen, she all but announced that Phase 1 is going to begin on May 8th or 9th. You think that's going to appease the people who are demanding this reopening?
I think the sooner we move forward with this, the better for everyone. I think the Reopen North Carolina movement is a good example and an illustration of how frustrated people are. And the longer this goes on, the more that frustration mounts. So I think moving forward with anything is the way we have to go. And there's going to be people who say that it's not fast enough. There's going to be people that say it's too fast. But I think moving forward, having a definitive plan, and as we do more testing and we get better testing, there ought to be more confidence in being able to move forward.
So, Chris, as we begin this reopen process, the governor has said that there are going to be some businesses that will open, some that will remain closed. Looking at it from a big picture type of thing, which businesses do you think should remain closed? Many people typically say hairdressers and barbers, but what other businesses should remain closed and which should be open?
Well, I think the rule will be which ones can be open safely, which one can there be social distancing, can we have restaurants open at less than full capacity and have no standing room around the bar where people are close together. I think there's a lot of common sense involved. There is a lot of decisions that are going to have to be made by public health people, by the administration. I do want to go back for a second to the Reopen movement. I don't disagree with Patrick or anyone that people should have the right to do this, that we have serious issues. I'm confused a little bit about what qualifies as what gets an exemption and what doesn't. But I do think it's not, we need to be honest about some of this movement. You mentioned the chaos. We literally had one of the co-founders who admitted she was tested positive for the coronavirus and didn't think she should have to stay in her house. But she thought she should still be able to go out.
She said violated her rights to be required to quarantine herself.
That's right. Number one. Number two, there are literally signs at that movement that talk about investigate the links between COVID and 5G. There's people that say no vaccine on their signs. There are people who are saying Cooper needs to go immediately. Some of those people had Trump signs. And as you mentioned, Cooper is literally following the dictates of the Trump White House. So everybody's frustrated. Becki is right. But I don't think we need to give over too much publicity to some people who, frankly, are way out of the mainstream and on our fringe and saying insane things.
We all know there's crazies in that movement. But I just want to be clear:
it's crazy enough to go around for all of us.
The blue collar workers, are the people that are suffering right now. They can't get their unemployment checks. They're the ones you can't work from home usually as a blue collar worker. I think most of us can, and those are the people that are scared to death, and I understand it.
Brad, what do you think of Governor Cooper's announcement that we're going to hold the World 600, the Coca-Cola World 600, on Memorial Day with no audience, but, of course, the television version of it will go on?
Well, I think they can do that in a very measured and responsible manner, Tom, and I applaud the governor for taking that approach. As we go through this phased-in reopening process, we're going to have step-by-step incremental openings and getting back to live sports. You know, I'm a big hockey fan, season ticket member. I miss it severely, but I understand the need for taking that step-by-step approach. I'll say this about Governor Cooper, too. Go ahead.
Go ahead. No, you go ahead.
I was going to say we got a minute or so left in this segment. Go ahead.
I think that he has this is a healthcare crisis, and he's let the doctors, the scientists, and the healthcare professionals take the lead on it.
UNC announced this week that they were planning to open their colleges in August. We don't know about public schools yet. The other big topic I want to bring up very quickly in about 30 seconds is the supply chain situation. If you've been in grocery stores, no doubt you've seen shortages of toilet paper and cleaning supplies and so forth like that. Will the supply chain come back, Becki?
Well, of course it will. You know, it always does, and supply and demand is a powerful thing. Yeah, but we're also hearing some things about some shortage of meat supplies. We're hearing this from Steve Troxler with the Department of Agriculture and some of the farming communities, and I think that's something we need to be very careful about.
And we're going to have a shortage of time if we don't turn around and begin asking our panelists to tell us something we don't know because we've been without it too long. Chris, I'll start with you.
Well, we talked a lot about the reopening and having businesses open. You know, that none of that's going to matter if the public doesn't feel confident you can go. You can have all the restaurants open you want, but if people don't think it's safe, they're not going to show up, which is why it's so important to do it carefully. The majority of people still believe it's not safe to do a lot of the things they normally do. The people will decide when things really reopen, not the government.
All right, Brad, tell us something we don't know.
Tom, the hospitality industry is going to be first and foremost in the recovery process. In North Carolina, it's a $25 billion industry, generating almost $3.9 billion in federal, state, and local taxes.
Wow. Patrick, tell us something we don't know.
Well, I'll just say something we haven't heard about enough is the antibody tests that have been really telling us a heck of a lot more about this disease than we ever knew before, and that is only a very, very, very small fraction of the people that actually have it know they have it, and especially the fatality rate is much lower. It's the people that are the older and the people that have pre-existing conditions that are in the most trouble. People like myself who had it, 32 years old, is going to be okay. So I think hopefully we'll continue those antibody tests that have been kind of in the background.
And if you're like me, I've got a 98-year-old mother in one of these nursing facilities, and the 40% death rate there is concerning to me. Becki, tell us something we don't know.
Well, Tom, something I didn't know until we started this was that I agree with Chris that as we reopen, you know, we really need to have confidence in people and people doing the right thing, not these government mandates. But the other thing that you may not know is, in light of all this crisis that we've been through, there are a lot of silver linings and a lot of things that we've learned, and moving forward, we might be able to do better. For example, look at how we're relying on telehealth and telemedicine and how that's opening up and increasing access for folks.
Online learning.
Online learning, and you know, different opportunities for kids to learn, recognizing all kids learn differently. And some kids have done really well with this. Lots of silver linings.
I got to give you the wrap here. You've heard our spin on the issues of the day. To stay informed all during the week, sign up for our free weekly email newsletter, give your feedback, and read my weekly column. Be sure to visit our website, ncspin.com, or catch NC Spin on Facebook. While there, be sure to subscribe to our free weekly email newsletter and our podcast. Well, join us next week when we take on more issues of interest to the people of North Carolina. Until then, stay informed and watch out for the spin.
If you think you may have COVID-19, please remember, people who are mildly ill are able to recover at home. If possible, stay in a specific sick room and stay in touch with your doctor. Be sure to seek medical care right away if your symptoms become severe, like difficulty breathing. Most important, whether you have mild symptoms or no symptoms, we should all stay home to prevent the spread of the coronavirus.
Life's busy, but you're in control. As an electric cooperative member, you have access to lots of tools to help manage your home energy use and budget, so you can focus on what's most important.
In more than 21 years on NC Spin, I never endorsed a product or sponsor, but I volunteered to do this message for family physicians. Over the past 40 years, my family doctor could quickly diagnose my illnesses because he knew my medical history. Evidence suggests I'll live longer, have a higher quality of life, and save 33% on health care costs. I believe in my trusted relationship with my family physician.
Family Physicians, your trusted healthcare advisor for life.
North Carolina Channel is made possible by the financial contributions of viewers like you who support the UNC TV network.